Okay, so childhood trauma, particularly sexual trauma, can have a profound effect on the development of a human person. And it can have far-reaching effects well into elder adulthood when the person is sexually abused as a child. That being said, there are some exceptions, a few people who maybe are naturally just a lot more resilient than others. There's some research that shows resilience might be related to genetics. And then also they might have the right conditions and opportunities in their lives to help them be resilient. But they're really the rare exception. For most persons affected by childhood sexual trauma, the scars are there for life. And after the trauma has been committed, how the person continues to be affected is through memories of the trauma, which come in many forms, not only visual images, not only unwanted, unprompted visual images, but tactile sensations as well. Scents, odors, feelings, physical feelings. And these can come because of triggers the person knows of, things that remind the person of the traumatic event, or things that were there during the traumatic event that the person wasn't really aware of while it was happening. But when they're present later on in life, they trigger this memory. And this form of memory tends to flood one's consciousness, waking consciousness, and can also flood one's dreams in the form of nightmares. So that's one. A second effect is the trauma. If a person's normal development is going this way, the sexual trauma can affect the nervous system in such a way that instead of going this way along normal development, the entire development of the nervous system responses to threat goes in this way, a completely different pathway. And the person's nervous system operates constantly as though it's under threat. And what this means in one's experience is a person is, in an everyday life with other people, is normally suspicious. That's the person's normal. Suspiciousness, distrust, mood swings, between what? Well, what's in the threat system? Anger, fear, paralysis. Usually depression ensues. People try to cope. Most people are unaware of help that's available or how to obtain it. Usually because when they're children, they tried to tell someone, or when the trauma is discovered, it's dealt with inadequately or not believed. So the child goes untreated and kind of has to survive and fend for himself or herself. And so these things that need to develop in a certain way, according to the normal course of development, in order for people to enjoy, friendships without suspicion, enough trust and confidence, mutuality, all of these things that a lot of people just take for granted. For them, it's a struggle every day. And what a lot of people don't realize is there's also a tremendous amount of shame that is imprinted there in the person's heart. And they're unable to talk about it, even to their spouses. On the average, people usually begin to talk about to just one other person, their sexual trauma, only about 30 years after it happened, if they do begin at all.